Cancer treatments. Traditional therapeutic measures include surgery, radiotherapy, and chemotherapy. At present, the usefulness of immunotherapy and modulating the biological response is studied. The main strategy for curative cancer treatment is excision of all malignant cells by surgery. In the past, this involved the removal of all affected tissue and as many potentially affected tissue, including neighboring tissues and lymph nodes. For certain tumors, especially breast cancer, is not precise as ablative surgery, in most cases. Improvements in surgical techniques, the possibility of an intraoperative biopsy, the advances in knowledge of pathophysiology, advances in anesthetic techniques and the availability of potent antibiotics and blood products, have enabled more limited surgery, less sequels, and more speedy recovery. However, many cancers are too widespread at the time of diagnosis for curative surgery possible. If the local extent of the tumor affects surrounding tissues that cannot be resected, or if there distant metastases, surgery is not a cure. However, it may be beneficial for the symptomatic relief of certain situations such as obstruction, or may have the objective of reducing the tumor mass to allow a better response to chemotherapy or radiotherapy treatment thereafter. One patient received radiation therapy to treat cancer of the spine. In this procedure, the radioisotope cobalt-60 is used as a source of gamma radiation. The higher dose of radiation is applied by a laser directed onto a treatment area selected. Ionizing radiation can be or electromagnetic particles and produce tissue destruction. The sensitivity of tumors to radiation is highly variable. Our sensitive tumors were those whose sensitivity is higher than the neighboring normal tissues. When such tumors are also accessible, superficial tumors or tumors in organs such as the uterus in which you can enter a radiation source, can be cured by radiotherapy. The radiation property respect somewhat normal tissues allows the treatment of tumors in locations where surgery is not possible due to the proximity of vital tissues or because the tumor has begun infiltrate adjacent structures that cannot be sacrificed. Radiation therapy is often used as a palliative treatment. Radiation therapy may be useful as an adjunct to surgery. Preoperative radiation can sterilize tumor cells quickly, preventing its spread during surgery. You can also decrease the mass, facilitating tumor surgery, or transforming an inoperable tumor in another operable. In other cases, radiation therapy postoperatively